Yeah, hello, good evening. How you day? Okay, welcome to my page. Today's date's now the 28th of June 2023. Happy Salah to all my Muslim friends. Always say you never send me my meat. Why? Good evening, good morning, good afternoon, wherever you do watch me from. So welcome to my page. And I did live on Facebook and I did live on YouTube. Now today I want to do small teaching. Yes, small teaching. Now before I continue, I want to talk something. If now your first time where you watch my page with this, I take gonna beg you. I appreciate you, but for here we know they prescribe medicine. Here we know they make diagnosis. Do you understand? Here now education we dey educate only. But right now I dey live and I can see that we have about 23 people watching me right now. So if you can hear me, tell me, Helen, good evening. Good evening, good evening. How you dey? If you know, say you dey hear me, drop in the comment section. Tell me where you dey watch me from, and then tell me if you dey hear me. Then share the live. Let's go. Invite your friends. Today I want teach quick. I want do small teaching, and I know say this topic they very interesting. Many people won't hear um this particular topic. Yes. Okay. Share the live. Share the live. I can see you. Good evening, Prince. Good evening. Yes. Oh yeah, share the live. Let's go quickly, guys. Oh yeah. Oh. So today's topic, the difference between fever and malaria. I dey hear you watching from Benin. Yes, okay. But Babalola is watching. Good evening from Benin. Babalola, wait now. Babalola from Abuja. Saint Mark. Saint Mark is in Benin City. Funke, Maryland, Lagos. The rest people unko una no one comment. Peter, Peter, I see you. Good evening. Vitalis is watching me from Abuja. Okay. Now, before I start, I take on in Begos. Make una support me. Share the live, please. I beg you. Christiana, how far now? Good evening, everybody. Welcome. So, quick. Let's discuss. What is the difference between fever and malaria? I made a post a few minutes ago, and I said um, no be every fever no be the same thing as malaria. No be every fever be malaria. People can't they shout. What are you talking about? Okay, so let's break it down quickly. Now, waiting be fever. Waiting be fever. Um, Fever. I hope my network is very good this evening. Good. Fever, hear me, means increased body temperature. Number one. Number two, fever na sign say something dey go on for your body. I don't know whether you hear me. Fever, when you hear the word fever, it means say your body temperature don't go up. It don't go up. Full stop. Fever again, na sign say something they make your body temperature go up. Now your body they keep your temperature normal. The way your body did, the way your body take arrange, we get things inside your body where they make your temperature they normal. But you get some kind things wey go happen to your body, your temperature will go up. But our people believe that whenever their temperature go up, na malaria be that, which is absolutely wrong. So I want to tell you right now, wetin dey cause fever. If you just dey come, you dey welcome. For those who they watch me for the very first time, you dey welcome. And for here, I dey teach, and I teach making it simple for you like ABC. Um, we don't prescribe medications here. I don't treat anybody online. I just teach you. You understand? I go beg you. I go encourage you to see your doctor if you get any medical problem. All I do on my page, as little as I can, is to just give you medical information. Good. So help me share the live now. I want to know whether you dey follow me or whether wetin I dey talk no make sense. We dey interact. My live session and they like follow you interact. So tell me, everything where I don't talk about fever, do you understand the few introduction where I give? It makes sense to you, abi e no make sense? Drop in the comment section quickly. Oh yeah, let's go. Everything where I talk about fever just now, if it makes sense to you, drop. Don't worry, we will continue. I said that fever means your body temperature don't go up, don't high. Number one. Number two, fever na sign say something dey go wrong inside your body. The next thing wey dey very very important to everybody listening to me right now is that wetin con dey make my temperature go up? Why am I having increased body temperature? If all you are saying is that fever is not malaria, okay, then why is my temperature high? And you say it's not malaria. So good, let's go together. Make una share. And I just want to know that they follow me, I beg. And everything where I tell you here, please take the information out and tell your people. The very common thing where they make people get fever and infection. Infection. So when I asked the question a few minutes ago, somebody said infection. But infection, na big topic, big word. So there are many types of infection that can make your body have temperature. Please don't ask any question yet. I will take your question. Just relax, no worry. I'm ready to talk with you this night. So infection, they make people body get high temperature. But listen carefully. Bacteria fit cause infection. Fungi fit cause infection. Virus fit cause infection. Parasites fit cause infection. So bacteria can give you fever. Bacterial infection, viral infection, fungal infection, parasitic infection. See my hand. Bacteria is number 1. Viral, number 2. Fungal infection, number 3. Parasite, number 4. Malaria is under parasites. You dey see am so? Malaria is caused by Plasmodium. Plasmodium na parasite wey the female Anopheles mosquito dey put for the body. So when the female Anopheles mosquito bites you, e go give you the Plasmodium, the parasite. When that parasite enter your body, come plenty, e go cause you one of the signs, fever. But other things fit cause fever. Bacterial infection, streptococcal infection fit give you fever. Viral infection, which common viral infection now? HIV is a viral infection. Herpes is a viral infection. Your influenza is a viral infection. Fungal infection, your candidiasis is a fungal infection. If it give you fever, your bacterial infection again, your salmonella, your urinary tract infection, they fit give you fever. E make sense, abi e no make sense? Make una share this video, please. Today, I know they teach most times like this, but today I just want to do small teaching. So I told you that infections can cause you fever. Another thing wey fit make your body temperature go up, wey fit make you get fever, high temperature, wey no be malaria, na severe forms of stress. You fit dey stressed and your body go start to dey react. Your body go dey tell you say there's a problem, I'm not okay, I'm not fine. Why? You are overworking me. And one sign wey your body go show you na stress, na fever. Your body will give it high temperature. But our people, whenever they hear say their body temperature go up, the next thing you go hear is I get malaria. It dey make us vex. Well, we dey vex because we don't teach you, but you no wan hear. For those wey no know, we no go vex for them. But for those wey dey like you now, wey dey hear me, you wey I don't teach you tire, they won't hear. It's not malaria. However, malaria na one of the things wey fit cause fever. But some people no get malaria, yet they get fever. But for them, whenever they get high body temperature and fever, they go think say na malaria. They will go buy anti-malaria, and then they go come on my page. They will come tell me say, doctor, I dey drink malaria medicine every time. Yet they go. They always get fever every month. They go. You don't know say no be malaria be your problem. Maybe now stress be your problem, or maybe now another thing where they affect your immune system. Now, um, Elizabeth say it makes sense. Funke say it makes sense. The rest of us, no one drop comments. If wetin I talk makes sense to you, drop am for the comment section. Tell me yes, e clear. I understand. It dey make sense. I dey follow you. I dey hear you. Put am for the comment section so that man know say you dey listen to me. Oh yeah, talk to me, talk to me, talk to me, talk to me. Let's go. Make sense. Yes, Saint Mark. Thank you, Mark. Thank you, Mark. Very good, very good, very good. Yeah, Mark, I see your comments. The rest people watching on YouTube, on Facebook, make una share the live and click on the like button. Good. Now another thing wey fit cause fever, na problem with the immune system. E get wetin we dey call autoimmune disorders. Autoimmune disorders. Autoimmune mean say the person immune system go dey fight am, and e get some kind sicknesses wey dey under that category wey fit still give you fever, but you go dey blame malaria. Example, SLE, wetin we dey call systemic lupus erythematosus. Forget about the big name, don't worry about it, abeg. SLE. Another one na rheumatoid arthritis. Another one na vasculitis. These are autoimmune. Dem plenty, dem plenty. Dem plenty well, well. Please don't ask any question. Just follow my topic. When you are entering the page right now, you just dey come. Please, no ask anything. Just keep quiet. When I don't teach, I can't talk to a question. You ask your question. I beg. So that may you no distract me. Now, another thing wey fit cause fever na medication. E get some kind medicines wey you go take, your body go react, you go get fever, but you go dey blame malaria. Example, some antibiotics. E get the kind antibiotics wey somebody go take, the person go develop fever, the body go hot. Do you understand? Yeah, that one dey. Then another thing again wey fit cause fever, wetin we dey call hemolytic anemia. Hemolytic anemia. See, abeg, ladies and gentlemen, I'm not here to impress anybody. I'm not here to blow medical grammar to make you impressed. I'm just here to tell you some few stuff. So whenever you hear me mention some kind medical name, just leave am. No crack your brain. I just dey let you know, say many things dey wey dey cause fever. So I dey list their names for you. You understand? Now, why people dey always talk say na malaria be their fever? You know why? Malaria dey very common for those living in Africa, West African region, Nigeria, Ghana, the West African region. Malaria dey very common. So whenever the person get malaria, the person go get fever. But that no mean say if you get fever now, it is malaria. No. But your doctor go wan confirm if this fever na malaria dey cause am or not. That is why they always test you for malaria, because malaria dey very common. But if your doctor test you for malaria and he discover say the malaria dey negative, you no get malaria, he go tell you say your result is negative, you no get malaria, but you no go believe, because your mind don tell you say as long as I get fever, na malaria I get. So let me tell you a story. Let me tell you a story. Let me tell you a story. Don't worry. I'm trying to make it very discreet so that, okay. So somebody one day, ladies and gentlemen, I beg, I need your support. Make una share this live. I want to see the number of shares I'm getting on this page. Share. And if you can send stars, don't forget to send stars. Send stars. Send super. Facebook, send stars. On YouTube, send super chat, super stickers. Now only 4 people don't share. See, only 4. Why now? Why? Make una support this page. Share the live, I beg. Thank you. Okay, good. Now let's continue. This person come see doctor. So the person told the doctor, I get malaria. And then the doctor asked the patient, wetin be your symptom? The patient talk, say, body dey pain me and I get fever. Na malaria I get. I know my body. Doctor asked the patient, is that all? Okay, we go test you for malaria and other things. The patient talk many things. The patient talk, say, no, No be you get my body. Now me get my body. I know how my body they do me. Now so my body they do me whenever I get malaria. So my sickness now malaria. Now listen carefully, ladies and gentlemen. This thing where I tell you now, so the patient talk am say now so e be and a malaria I get. Abi you no wan treat me, you know sabi work. Okay, so they give the patient anti-malaria because the patient was very, very stubborn, very stubborn. Okay, but then document and write am say the patient refuse and refuse because if you no treat am, he go outside go himself. After 1 week, the patient come back. He talk say I never well oh, I never improve. Abi this una malaria medicine na fake. Ah, dem talk say okay, make we do test for you now. You go gree. He say oh, make una do test. So they carried out the test, and it was negative. The result came out negative, no malaria. Then the patient talk say na lie, say this una medicine no work, I get malaria. Patient on your own oh, come go out and outside oh, come go buy another malaria medicine oh, come take. As you take the malaria medicine now, thank you for sharing to 16 people. Ivie, Ivie, how are you? Ivie, how are you? Long time. How have you been? Thank you for sharing. God bless you. I appreciate very, very much. You can't buy another malaria medicine. You can't take. Remember, 1 week don't pass. 2 weeks, the patient no improve. The patient talk say, you know well, he can't come back again. When the patient come, they can't tell and say, now you go let us treat you. No one know what they happen. By this time, the patient don't dey sick. The patient no know well, many symptoms. They can't say make we test. They can't test many things. Many things. Lo and behold, the result came out positive for HIV. Positive for HIV. Now, see, let me say this one. Just put them for somewhere. Make una no come dey shout. HIV is not a death sentence. People get HIV and they are living their best life. I'm just letting you understand that. No be every time you go talk say na malaria you get. Because this person, they sick malaria every month. No, say something else they causing problem, but they blame malaria because they get fever. Now, I don't tell you from the beginning, say fever no be malaria. Malaria na just one of the causes of fever. Just one out of the so many causes of fever. Even hormonal problem, hormonal issues, thyroid disorders fit cause you fever. Hyperthyroidism fit cause you fever. Some women, when they near their time to menstruate, their body go change hormones, their temperature go up. Do you understand? So many things they cause fever. But this patient, he no gree here. Yeah. Yes, it's been a long time. Yes, yeah, no problem. Okay. Now, if everything where I talk about fever and malaria, it dey clear to you, drop them for the comment section. If everything where I talk no make sense to you, like doctor, all the things where you talk, I beg, and it no clear. Tell me what you no clear, and I will explain them again to you. Tell me. I don't break them down for you here. For those who start with me from the very beginning, I don't tell you the difference between fever and malaria. So I believe you go dey clear. But for you, if you know say no clear to you, tell me. Wetin no clear, ask them. Then if you get any question where you want ask on this particular topic, ask me. Then if it dey clear to you, I don't happy. My mind don't switch me. It means that I have achieved something tonight. Therefore, you carry this information, go your village, your community, your WhatsApp group, your church WhatsApp group, your village meeting, your market women. Whenever somebody they tell you say they always get fever and they get malaria because they get fever, tell them say no, something else fit dey cause your problem, and you go dey blame malaria. It's not that you know fit sick malaria every month too. It's not that you know fit sick malaria. Let's say this month or last month you get malaria, they treated you. This month mosquito come bite you again. Well, you can still have malaria. So our job now to find out why you dey always get malaria. Is it that your house mosquito full there, or you know get mosquito nets, or your immune system they very bad, or you get bushes around. Do you understand? We go find out why. Hmm? What can I do now? Okay. I don't know what's in the apple. Make una share the live for me, I beg. Okay, good, 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 good. Yeah, I'm going to come to your comment. So ask me a question. Ask me a question. Very clear. Why is a okay? Wait, before I come to your question, Elizabeth. Elizabeth. Now we won't enter question session now. On this topic, I beg. No, ask me anything outside this topic today. Please. I want to take questions related to this topic tonight. But if you just they come, I go beg you, no ask us, you no go understand. Just they listen. But for those we just they follow me since, so let's start taking all our questions. Um, please share the live, I beg. Like, and then don't forget to send stars. For those with you send me stars, I go appreciate them if you send me stars on YouTube or Facebook. Okay, so let's take Elizabeth's comment here. Why is AA genotype group susceptible to malaria? So waiting Elizabeth, they ask us, they say, why people will be AA? Why did they always get malaria? Why? Why? Okay, oh God, my network is messing me up, guys. How do I send stars? Somebody wants to send me stars. Let's see where you are. Okay, Elizabeth, if you want to send stars, just look below your screen. You will see one star icon there. Who don't send me star before? I beg, just respond to Elizabeth. Tell her how to send stars. So let's answer your question now. Hmm? My network is messing up. My network is messing up really. Um, Number one, no be everybody we be AA they get malaria. I don't want make you get that belief. Say because you are AA you must get malaria. No, get many AA we never get malaria for more than 5 years. I know them. I know them real life. Number two, now if mosquito bite AA and mosquito bite AS, there's a very high tendency saying that the person will get AA then go get malaria. You know why? AA, their blood is very okay for mosquito parasites, the plasmodium, to survive and grow. The AA, their hemoglobin, their red blood cell, they very okay. I'm using the word okay for you to understand. They're very conducive for that parasite to grow, multiply, develop, and come out. But for the other genotype like AS, when the parasite enter the blood, before e go fit multiply do im damage, the blood itself go break, go disintegrate, go destroy. E no go give the parasite enough room, enough time to multiply or develop fully. E make sense abi e no make sense? E clear abi e no clear? So AA is good. AA genotype is good. However, that AA, their genotype, and the hemoglobin genotype, they're very conducive. Now, the history of AS, can I break this down for you to understand? Mutation, genetic mutation, meaning say AA people in the olden days, mosquito show them shaggy. Mosquito show them shege. So their own body can't they look for ways not to allow mosquito show them shege. They can't develop another genotype, AS, to help them survive mosquito. So AS genotype then talk due to research and the science area talk say now due to mutation it change to help them develop resistance to malaria. So S come form. so that when malaria parasite enter their blood, e no go fit cause them problem. Because in the very olden days, malaria show AA people, e show them shege. So their own body, in a way to adapt and survive against malaria, S genotype conform. That S genotype come make am impossible for mosquito parasite to dey grow anyhow. So before e go grow, the blood go break, the parasite go die. But when e enter AA body, e go dey there, everywhere dey fine for am, e go multiply, develop, born pikin and spread. Good. Una no dey respond to me now, say e make sense, e make sense. You know they respond. Oh yeah, everybody, I want to hear your comment. Tell me, yeah, it clear, you know, clear. I have already shared to my WhatsApp, to my church group. God will bless you. People know they want shared. Can too much caffeine cause fever? It's possible. It's a possibility. Yeah, it's a possibility. That's the answer. Most medical lab tests for malaria and widal. Most medical lab tests from MP and widal, we always have something to put there. Yes, that is the truth. But sometimes malaria they come out negative. But for the widal is no longer a use. Let's not go there, beg, beg. I don't want to take myself off this topic. Another day we go talk about widal. Yeah, let's not go there. It will take us totally out of this topic. So let's stick with this one. What's your name? Albert. Mo could just stay here, beg. If I start to answer your comments, your question, this is your question. We will come up for this topic. I have shared. Thank you for sharing. Thank you. Thank you. How do I send stars? Make una help me teach Elizabeth. So Elizabeth, Madam Elizabeth, when you go to the page, this page, down, beside, you will see star up this side. Click on the stars there. Then you can send stars. Ivie, I've answered the question on AA. Yep, I've answered. It's clear. It makes sense. It's clear. God bless you. I see una comment. Ajayi, is Ajayi in this place? Ajayi, God of heaven. I don't see you. Let me see something. I just enter now. I talk him. Ajayi is in the house and she don't send stars. I don't see your stars. 50 stars. Hey, hello. Where then they? Where then they? I see you. Hello. Good evening. What be your name again? This your name. This your coded name on Facebook. Anulika. Is it Anulika? Can't remember. Yeah, good evening, Ajayi. Thank you. I see the stars. Thank you. I just enter, yes. I have already shared in my parish WhatsApp platform and others. Wow. Thank you. Thank you very, very much. Thank you. May them come. Don't worry. Doctor, you are doing well, making health easier. The truth is that health education is supposed to be easy for everybody to understand. It's supposed to be easy. So our job now to try make them easy for everybody to understand. So thank you to everybody sharing. Thank you very, very much. Ajayi, how you dey? How is the family? Olivia, good evening. Joy, good evening. So ask me your question now on fever and malaria. For those who just they come, we spoke about fever and malaria. What will be the difference between fever and malaria? Our people believe that whenever they get fever, they don't get malaria. No be every fever be malaria. Do you understand? Yeah. My voice don't they go down, waiting they happen. Now what? Doctor, I get exam presentation tomorrow. Please pray for me. You go pass now. You cannot know me and fail. You know they see the way they talk, the kind of confidence why they give you. You can't do that. We know they fail by the grace of God. No matter how the exam hard, we know they fail. So you yourself, you know, go fail. And I believe that you've read, Abby. You don't read, so you go pass. No fear. Just put your mind to get that. Nothing they happen. No matter how many them be for the exam, all the guys, professors, you go blast them. Yep. Can too much caffeine cause fever? I've answered you, my guy. Yes. Oh, Joy is just coming. Joy, una just they come. So now another thing I want to tell you about fever and fever generally is that When somebody get fever, the person fit get other symptoms. For those wey come late, no vex. Abeg, no vex, no vex, no vex. You go watch from the beginning. Uh-huh. For those wey get fever, you can have other symptoms attached to the fever. Example, when you get increased body temperature, you fit get headache. Sometimes you fit get cold. You fit get cold, chills, your body go dey shake. Sometimes you fit get body pains, joint pains. You fit dey. You fit get loss of appetite. You fit get vomiting. You fit get nausea. All these things wey I mention, many type of sicknesses fit cause am. No be malaria. So because you get fever, I repeat again, no mean say I don get malaria. No. Destiny, I dey fine. Does dehydration also cause fever? Unlikely. On there, even if you go cause fever, wetin be your name? Ajayi don send me 100 stars. I go pin your name there. I go just put your name, and I no go talk. I no go pin anybody comment for a while. Yeah, thank you. You go just enter my page, just dey knack me stars. Thank you, thank you, thank you. Okay. Thank you, Ajayi. I appreciate so much. I appreciate. See, my throat don't dry. How many more minutes I don't spend for here? How many minutes I don't spend? 31. Okay, I have 15 minutes more and then I'm done for tonight. So dehydration will not cause you fever immediately. You know, go cause you fever immediately, huh? Yep. Dehydration no will cause you fever immediately. It will cause other problems. Other problems. Yep. Okay. Any other questions for those who watch from the very beginning? Huh? Oh yeah. Oh yeah. Oh yeah. Oh yeah. Oh yeah. Share the live. Share the live. Share the live. Share the live. Let's go. Ajayi don't send me 200 stars. Interesting. I'm trying to send stars. Oh really? Oh, Felicity. Doctor, does seizure cause malaria? No. Okay, no. Let's take this one. Let's take this one. Let's take this. Let's take this. Having undergone a negative malaria test, can cause of fever be detected through full blood counts? Okay, this is a very good question. This is a very good question, Elizabeth. So, full blood count. I can easy for us to understand. So, I dey convert the thing for my brain. Full blood count will give us sign on the likely thing wey dey cause am, whether na bacteria, whether na virus. It will give us sign from the white blood cell count. It will give us sign. But to know the exact cause of the fever, most times, depending on the symptom wey the patient gets, they fit do blood culture, or they urine sample, or they fit take swab, or they fit do many type of different tests dey. However, full blood count go point you to say yes, so this thing wey dey happen for here likely be like say na bacteria dey cause am, or na virus, but there is an obvious infection going on here. Shey you get? So no be only full blood count go just confirm bam say na this thing dey cause am. No, you go need other type of test depending on the type of symptom wey the patient gets. This thing wey I dey talk, so I dey give hey God, I'm giving heavy medical information here. Does seizure cause malaria? No, malaria can cause seizure. Malaria can cause seizure. We are not teaching malaria fully. You get what we call cerebral malaria. Malaria gets wicked complications. You get how malaria fear affects somebody for brain. It go cause cerebral malaria, it go affect the brain. The person fit get convulsion. Or the malaria fit carry the fever go very high. When the fever go very high too, it fit cause convulsion. Do you understand? Okay. I'm trying to send stars. Oh, really? Oh, don't worry. It will work. Thank you. Thank you. Apart from fever, which other things go cause body pain? Many things now, my guy. See, what's your name? Sir. I don't know. I don't know. Sir Victor. Mr. Victor. See, listen carefully, I beg. Listen carefully. You know what I do on my page, Abby? Just not teach. Body pains we come from stress. Stress, when I say stress, I mean stress we give body pain. Fever no dey give body pain o. Fever na one sign. Body pain fit follow fever. So no be say because you get fever you must get body pain. Some people fit get fever because they take medicine wey their body no like, and they will get fever yet they no get body pains. So you can't just sit down on the internet and think that you can analyze your body like this. So I just want to help you. Some people will get fever, they'll get body pain. Some will get fever, they don't get body pain. It's left for the doctor to actually find out this thing now something related. Not everybody will get fever will get body pain. I just differentiate between fever and malaria here. How are you doing? Magdalene, I'm doing good. The normal white blood cell range. Oh no, that one you can get it on Google now. Elizabeth, leave that one. That one is not important for this discussion. Hmm? That one is not important for this discussion. It's not important. Waiting patient won't use normal white blood cell count range do. Hmm? What you want to do? Is typhoid fever, doctor? They are the same. Malaria is fever. You just dey enter here. Wetin be your name? Stella. It's not the same. Oh, malaria is not fever. Ladies and gentlemen, can you see Stella? Stella does not understand. She does not know. Instead of her to ask question now, she's telling us wrong thing. She's telling us totally wrong information on the page. Very wrong information. So, Madam Stella, you just dey enter here. Go back to the beginning of this video. Sit down and watch it. I can beat my chest and tell you that if you watch from the beginning again, after I end this video, you can understand fever and malaria, they are not the same. So when you come to my page, unless you get facts backed with reference, no they comment anything where you know if you defend though. Sure you get. So you are wrong, I beg. You are very wrong. You're very, very wrong. Yeah. Is typhoid fever same as fever? Hey God. Typhoid fever is just one of the causes of fever. We get typhoid fever, we get yellow fever, we get Lassa fever, we get Ebola fever, we get dengue. Is it dengue fever? So many types of fever are there. Typhoid fever na just one now. Na just one. Our people think say they know fever whereas they don't know anything about fever. You just know one fever: typhoid, yellow fever, malaria type of fever, Ebola, Lassa fever, and many types of fever. Gloria sent me 99 stars. Gloria, God go bless you. I see your stars. Thank you very much. So when you come online like this, your job is to keep your mind open. For those of us who into the medical area, our job not to rub mind together. You understand? But for those of us we don't really know, our job now try to keep your mind open and then also do your own research. They are not the same. Typhoid fever now just one type of fever. Yeah, and malaria is not the same as fever. Stella, good night. I just sent out the last 100 stars. Thank for all you do. Thank you so much. Thank you. I wish you success. I wish you success. Yeah. Take care. Success in your exams. How to stop fever? Okay. I get how many more minutes? Few more minutes and then I'm done. Very good question. Look, listen carefully. Listen and listen again. You listening to me on Facebook or YouTube. The very first thing we will tell you, if your temperature dey high, you go need to bring them down first with water or paracetamol. First, you know why? You get how the fever go high too much, you go cause problem. If it cause seizure, so we no want make your fever go too high. For parents we get children in the house, we dey encourage parents make dem get thermometer and make dem get paracetamol at home. Yes, so that when you see say your pikin temperature dey go high, No wait, bring the temperature down, and then take the pikin to the hospital, because paracetamol no go cure the fever. Paracetamol will not cure, it will only bring down the fever so that e no go cause you problem, you no go get seizures, convulsion. It's now left for the medical folks, the medical community, to find out wetin dey cause your fever. When dem know wetin dey cause your fever, dem go come treat am. When you don't know what is causing the fever, wetin you wan treat, wetin you wan correct? If you follow me from the beginning, I tell you say many things dey cause fever: bacteria, virus, fungi, parasite, stress, hormonal issues, autoimmune disorders, inflammatory changes fit cause fever. So you no fit just sit down for house because say your temperature high, you believe say you know wetin dey cause your problem. Just like that patient wey talk say e get malaria, whereas e get immunosuppression. Hmm? And I have to say this again on my page, because this page on my page, and I can say what I want to say. You cannot treat yourself or even treat yourself through the internet. Many people don't try them, they don't die away. I'm using the word that. Okay, I'm not going to repeat it again, because they feel that when they get medical problem, they feel just go online, go search their problem, buy medicine, drink. Some of them don't die away. Very bad. So my job here now to tell you, no try them, no do them. As much as possible, get a doctor that you can speak with, that you can consult with. Hmm? That you can consult with. Get a doctor. If you know if you do hospital, you can have a doctor you can consult, you can call, you can speak with. So that you know, they make costly wrong mistakes with your health, because when life go, e don't go. Now one life person gets. So my job here now to ensure say you don't make those kind of mistakes. Not be to come here, come they treat, or they tell you to go buy these antibiotics and buy that. Sure you understand? Um is malaria a disease caused by plasmodium? It is what? It is a disease. It's an infection. It's a disease now caused by plasmodium. There are different types of plasmodium that causes malaria. Now mosquito, the female Anopheles mosquito, we get the parasites. That plasmodium parasite. If you bite person, you put the parasite for the person body. You can't cause problem. We get different types of plasmodium parasites. Different types, about four. Some say na even five a day, but four and they cause problem. Does fever cause weakness? Not in all cases. Some people fit get fever and they will get weakness. Some will get fever, they will get body pain. Some will get fever, they will get loss of appetite. Some will get fever, they will get abdominal pain, they will get vomiting, they will get red eye, they will get severe headache. So fever na just one symptom. Weakness na another symptom. Body pain na another symptom. Loss of appetite na another symptom. Vomiting na another symptom. All of them fit dey together, and when dem dey together, e go help us know say this thing na something dey cause am. No be fever dey cause weakness. Fever is not a diagnosis. Okay, let's leave like that. Fever no be diagnosis. Fever na sign say something dey go on for your body. Fever no be sickness. I don tire. I wan go. Abeg, if you just dey come, please watch from the beginning again. You understand? I don't talk, and I've tried. Thank you very much. Thank you. So as I round up tonight, please, for those who just dey come, abeg go and watch the video from the beginning. Um, um, no, please go to the hospital. What is your name? Divine, please go to the hospital. If you feel bloat at the lower abdomen, does it mean a patient has malaria or fever? And does it cause no? I can't tell what it is. Please. Bloated abdomen is a total different stuff. Malaria and another thing, you ask me. Frequent urination, another thing. They might all be going together, or na different thing they cause them. Do you understand? So please, I'm saying this with all authority. This page na to teach. This page no be to confirm anybody diagnosis. So if you get bloated abdomen, bloated, be like say gas dey the belle, how are you telling me that that is malaria unless you have carried out a test and the test confirms say you get malaria? That is why I go tell you, go to the hospital and no be the type of doctor wey go come online, go come dey find to try to make you happy and tell you go and buy this, go and buy that. I don't do that. I'm very, very careful with human lives, and I'm very careful with my medical license. Now sweat and blood we take get the license. So when we dey talk with authority that we work for the license. And one of the things we are given the license to do is to ensure that we protect human being life. And one way to protect your life now to ensure say you get the right treatment, not on the internet, not on social media, but consulting with a doctor, a licensed medical doctor. You know why? You know why? There are many people where they call themselves doctor and they are not licensed. They are not even doctors. They don't enter college of medicine. Many of them, many of them dey social media. However, we get licensed doctors too on the internet. So the best thing for you is to go to the hospital, see your doctor there, and tell your doctor your complaint. Yes, we get so many doctors. Some day where I know, some day where I don't know, and they are very good and they're on social media. You get some where I know some of them, they are not medical doctors. I'm not going to come here and call anybody's name. I don't have time for those nonsense. But if they carry their problem, come meet me. I will give them problem too. You understand? So everybody they mind their business. So my job is to ensure that you do the right thing with your life. And I'm not going to try to make you happy and make you love me by doing the wrong thing. So no vex. Please, if you have any medical problem, always speak with your doctor. No vex, I beg. Yeah? I'm not bad or anything. I'm angry with you. No, no, not at all. I'm just re-emphasizing what I do on social media. Yeah. Is it every time I feel feverish that I should go to the hospital to find out what is happening? No. Okay, this is a very good question, Choma. Now, a very good question they ask me. You know why? Sometimes change of weather will make your body get fever. Example, right now the weather they cold. The weather they cold. Me, as I dey follow you talk, my body they hot because the weather is cold. You know, when the weather they cold, people they get catarrh, they sneeze, they get fever, and the rest. Normal changes. So if na the weather or na stress, they cause your problem. Sometimes you might not need to go to the hospital. Stay house, rest, take your paracetamol, take your balanced diet. You can take your vitamin C and rest. But if you don't rest, first day, second day, your fever still dey there, and you dey get other symptoms, then it go dey wise to speak with a doctor. No be say because you just get fever today, you just enter hospital. You know, sometimes nobody like to dey go hospital, and I no go pretend as if say hospital na good place. Abi no, no be everybody like hospital like that, and sometimes no be everybody get money. So wetin you go do be say take time to study your own body. Oh, I stress myself. Oh, I no eat, I no sleep well. Now the weather, try rest. But when you don't rest, you don't take your paracetamol to help you, and your fever can't continue. You can't dey get body pains, you know, they feel chop, you dey vomit, you dey get abdominal pain, you dey get headache and the rest. Then I think it's good you see a doctor. Is that okay? Yeah. Hmm? Yeah. Thank you. Um, good afternoon here, watching from New York. Adekunle, how far now? How is New York City? Yep, good life. Yeah, faith, good life in a sense. So thank you, everybody. Thank you very much. Yes, as I round up tonight, I know that some people will just dey come my page, no really know, say, I know they do private chats. I know they give number. So I beg, in case you dey listen to me right now and you dey try send me private message, no vex. I know they do private chats on social media. My all I do online, I could just tell you like this and go and see your doctor, please. So in case you send me message, I know they open my private inbox on social media. It dey closed. They're very, 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 very close. And I'm not even really, I'm not that interested in having a private consultation with you. My job now to beg you to go see your doctor wherever you dey. No vex. I know they give number on social media. I just come online like this. I teach you. I mind my business and do what I can do, and then I disappear. No vex. Like I always tell you, good life now waiting. Good life nah sense. Good life nah sense. So thank you for listening. Thank you for joining. Gloria, Evie, Funke. Hey, I saw your comment. I saw your comment. Yes. Okay. Ask me. Uh, may I ask a question not related to fever? Yes. Ask me. You ask me. Ask me. I beg. Ask me. Sorry. I'm just seeing your comments. Ask me. Yes. For you. I'm ready to take your questions. Oh yeah. Ask. Let's go. Oh yeah. Now let's go. You tread. Are you still here? Oh yeah. Ask me your question. Yeah. Oh yeah. Now. Sorry. I'm just seeing your comments. Oh yeah. You get some people when they ask questions like this, I see their comment like this. Ah, oh yeah now. You don't come out. Hey God. You tread Watson. Are you still here? I'm waiting for you. I'm waiting. What about me? I'm not gonna pin your comment. Leave me alone if you oh yeah now, you tread. Talk to me now. If you leave me alone, no. Okay now, you tread. Are you here? Oh my God. You don't come out. No vex. I'm just seeing your comments, No vex. Oh yeah, let's go. You know here? You don't go. Good evening, blessing. Good evening. Let's see. To all the people that send stars, I appreciate every one of you. Where is Utrecht, Watson, or let me see. Are you still here or you don't come out? So I have 32 people, 9 and 2 people on YouTube. The people on YouTube, how far? Una know they drop comments. I'm joking with you. Me too. I know. I know now. Where is Utrecht though? Where is Utrecht? Oh God, Utrecht is not here. Okay, so it's time to go, guys. Thank you very much for your time. God bless you all. Take care of yourself and have a wonderful evening. Like I always tell you, good life, good life, sense. Take care and bye bye.